Welcome back. If you thought heart disease only affected older people, think again. In fact, it's affecting more younger people than ever before. Here's local cardiologist Dr. Bernard Ashby. Dr. Ashby, welcome to the show. How are you?
Pleasure to be here. I'm great.
Okay, good. We're going to talk about heart disease on the show. We're going to talk about how it actually can affect younger people, which people may not realize. But before we get to all that, let's sort of define what heart disease is.
Well, most folks think of heart disease in general terms, but more specifically, it's related to plaque in the arteries. And folks believe, or at least we've communicated, that plaque in the arteries is akin to hardening of the arteries, and it's not. It's really what it sounds like, plaque buildup in the arteries. The plaque that's in the arteries kind of looks like a porous substance. It's a soft, gelatinous substance that builds up in the arteries. And this is what ultimately blocks up the artery and leads to lack of blood flow to the heart muscle, causing a heart attack.
Jeez, and that porridge is definitely not just right. That is not the porridge that Goldilocks wants anything to do with.
Not the kind of porridge you want in your arteries.
What are some of the contributing risk factors to the porridge buildup to the heart disease?
So this is actually well studied, and it comes from a study in Massachusetts called the Framingham Heart Study, and it basically looked at what factors were associated with heart disease and more broadly heart attack and stroke. And again, this gets back to the point of plaque in the arteries, atherosclerosis. And those factors were broken down into non-modifiable risk factors and modifiable risk factors. So the modifiable risk factors, the ones that you can change, are smoking, hypertension or high blood pressure, diabetes, high cholesterol, and lifestyle. So just being eating well and being more ambulatory or exercising. Mm-hmm. And the non-modifiable risk factors are being a man, age, and family history.
Why are men more susceptible to it than women are?
Well, it's really because women have a protective effect because of estrogen. And they generally do not manifest symptoms of cardiovascular disease, more specifically heart attack and stroke, until about 10 years after men. So men generally present around the age of 65, and women generally present around the age of 75. But again, there's a wide variance, and so you could be a little bit earlier, a little bit later, depending on your risk factors.
So you talk about heart disease, then you talk about the term heart attack. Mm-hmm. How much does the disease have to do with the heart attack? Do you get a heart attack independent of heart disease, or are they related?
It's a great question. So heart disease is a general term. So anything that affects the heart is considered heart disease. But what we're talking about is coronary artery disease, and coronary artery disease related to plaque buildup in the arteries. And so the heart, just like any other organ in the body, requires blood flow. And so it has arteries that supply the muscle. And when you have plaque that develops inside of those arteries, that could lead to progressive blockage. And if it blocks it acutely or suddenly, the lack of blood flow to the heart leads to heart attack. So when we talk about heart disease, it's a broad term, but we're really talking about coronary artery disease, which is this plaque buildup process in the arteries of the heart.
This plaque, so okay, so you mentioned a moment ago that for men, they start showing symptoms around 65, women 75, right?
Yes, correct.
But even when you're far younger, some of this damage can start to be done, right?
Yeah, that is very, very, very true. So the process of plaque accumulation begins at a very early age. And many folks have it in their head, or really because of what they've heard through medical education, that the process kind of starts when you're 65 or 75, because that's when you see the heart attacks. But in fact, it begins early on. There was a study that was published in the year 2007 that showed that patients were actually developing this plaque buildup process early on. And so the study looked at approximately 2,000 men and women, but the predominance of the patients were men who died of other causes, mostly traffic accidents or accidents of various causes. And basically what they found is that the process begins early on. And so it was only about 5% of the patients, but suffice it to say that the patients that had the risk factors were developing the plaque buildup early on in life.
So that means that younger people need to be more conscious about what they're eating and about exercising. They obviously shouldn't smoke.
Yeah, correct. Yeah. Correct. And every risk factor has varying impact in terms of your risk of heart disease. But suffice it to say, the earlier you start in terms of mitigating your risk factors and controlling those things beforehand, they can have a great impact on your long-term health.
And younger people can get heart attacks as well, right?
That is correct.
Yeah.
That is correct. It's rare. It's mostly seen in males, but it can happen to anyone. I've seen it happen in young men, recently at the age of 22, but I've also seen it happen in a woman at the age of about 28. And her main risk factor was type 1 diabetes, poorly controlled, didn't really seek medical care, and came to the ER with a heart attack. So although it's much less likely in women and less likely in men, it's still possible, and especially if you have the risk factors that are at play, especially if it's a strong risk factor at play, then you can manifest the disease at an early age.
Okay, now that we've terrified everybody, old
Yeah.
people, young people, men, women, everybody's terrified.
Yeah, you should.
And everybody's going like this right now.
Yeah,
Everyone's
yeah.
doing that. What are some of the risk factors, some of the symptoms? Are people going to feel stuff for them to go to a cardiologist? So should the average person sitting at home go get a physical tomorrow? What should people do?
So I always believe that everyone should get screened, meaning that you should go see your primary care doctor and just talk to them. Tell them what your family history is, tell them what symptoms you're having, and discuss your lifestyle, and also talk about what tests should be done. And this can be done by a primary care doctor. You do not need to see a cardiologist to be screened, at least initially, for heart disease. Now, if you have certain risk factors that are much stronger than others, or if you have a family history, then seeing a cardiologist might be prudent. But suffice it to say, again, that seeing a doctor is where you should start. Okay.
Yeah. As we get to the new year and people are big on their resolutions right now, what are a couple of good ones that you recommend for heart health?
Oh, okay. So it begins with lifestyle. All right. So the American Heart Association recommends about 150 minutes of exercise a week, which breaks down to 30 minutes of physical activity 5 days a week. And that's just cardio, just running, riding a bike, swimming, anything that gets the heart rate up. And in terms of diet, you want to adhere to a heart-healthy diet. Most of it is common sense, but it's important just to go over certain things. So in cardiology, we recommend the Mediterranean diet, and that's just cooking with olive oil, eating more fish, trying to get omega-3 fatty acids through that, cutting down on the fried foods and the saturated fats, eating more nuts, legumes. And also, if you drink, red wine is actually a great option.
Red wine is good. Okay. Last thing is stress. How big of a risk factor is stress? How much damage can stress do?
Stress can do a ton of damage.
Yeah.
The literature is variable when it relates to stress, and that's because it's an indirect risk factor for heart disease. Meaning that if you're stressed, it's hard to really quantify that because stress is a very subjective term. But we do know that when folks are stressed, if they feel stressed, they release more catecholamines, more growth factors. These are things that adversely affect the heart and blood vessels. And so trying to decrease your stress is always a good thing, and that's something that I recommend routinely for my patients.
Okay, so as we say goodbye, people now are going to have some questions for you. They want to reach you, they want to see you. How do they get hold of you?
So if you would like to reach me or any one of my colleagues in the Department of Cardiology at Mount Sinai Medical Center, the number there is 305-674-CARE, and that's C-A-R-E.
Easy enough. Dr. Ashby, good to see you. Happy New Year, happy holidays,
Pleasure.
and
Happy
we'll see you again
holidays to
soon.
you as well. Thank you.
You got it.
All right.